Okay, hi, my name is Olivia, and I'm going to be talking about health in Thailand. So we're going to start with a quick nutrition overview. The national dish is pad Thai, which a lot of people know about. It's very popular. Consumed very frequently are fish, legumes, and red meat. And on the other end of things, nuts, whole grains, and dairy are not consumed all that often. Thailand is a very food secure country at the macro level, but many families living in rural areas have difficulty accessing food, which is shocking due to the large rice industry. This relates to the SDG of zero hunger, with 6.5 million people in Thailand food insecure. 5 million people in Thailand are obese due to having to resort to higher calorie dense foods than healthy options. And 600,000 children are suffering from malnutrition. So Thailand ranks 59th on the list of undernourished countries, which is pretty high up there, but their percentage of malnourished population has decreased from 1990 to 2019, down to 8%. Malnutrition in children has also decreased, but then it began to increase again after 2016, which could possibly be due to Thailand's military-appointed legislator voting to impeach their former prime minister for her role in overseeing a government rice subsidy program that did not do very well and lost billions of dollars. And this is just showing how the malnutrition in children has increased after 2016 for all categories: stunting, wasting, and overweight. So we can measure nutrition status for large populations by looking at BMI. Thailand ranks 138th on the list of countries ranked by mean BMI scores in 2015, with their overall BMI being around 24.1. And only about 41.8% of the population was found to be obese. So for women and children, the national birth rate, infant mortality rate, and fertility rates have all decreased since 2021. But infant mortality rates have decreased almost double fertility rates, which is showing more babies are surviving, which could be due to the COVID pandemic. So birth statistics: the average global birth weight is between 5 pounds 11 ounces and 8 pounds 6 ounces. There's a prevalence of low birth weight of 11 per 1,000 births, and additionally, abortion rate is 68.7 per 1,000 births, which could be due to 50% of pregnancies in Thailand being teen pregnancies. Breastfeeding. So it is recommended to breastfeed exclusively until 6 months of age and then continue breastfeeding until 2 years of age. However, only 23 infants aged 0 to 5 months are exclusively breastfed, and 15% of mothers chose to continue breastfeeding until 2 years of age. Breastfeeding is allowed in public in Thailand, but due to cultural norms, women tend to not do this as often or do this more discreetly. And lastly, I have the growth charts. The dashed line is showing the 50th percentile for a normal child, and the other lines you're seeing are for children with Prader-Willi syndrome, which is a rare genetic disorder.
As we all know, there has been a global downtrend in the number of deaths from communicable disease thanks to improvements of technology and living conditions in most parts of the world. Much like the rest of the world, the COVID-19 pandemic affected Thailand in similar ways through the loss of jobs, income, and food security for many. Besides COVID-19, the most common communicable diseases in Thailand are malaria, HIV, and tuberculosis. Malaria doesn't pose a threat to those living in the larger urban cities in Thailand, but can be an issue for those living in the rural forested parts of the country. The east and west borders of Thailand near Myanmar and Cambodia are home to a drug-resistant strain of malaria called Plasmodium falciparum. There are about 550,000 people in Thailand living with HIV. Stopping the spread of HIV seemed inevitable because of the sex tourism Thailand is home to, but prevalence of HIV in Thailand has dropped by more than half in the last 10 years. The World Health Organization has named Thailand one of 22 countries in the world with the highest rates of tuberculosis. The incidence of tuberculosis was on a downtrend in Thailand, but began to rise again due to the spread of HIV in the country. Tuberculosis in Thailand mainly affects people of lower socioeconomic classes that can't afford the treatment. Thailand is doing an overall good job of combating and treating the communicable diseases it faces. Despite the case of drug-resistant malaria, Thailand is on track to achieve its national strategic plan of eliminating malaria by 2024. The CDC in Thailand works with the Thai Ministry of Public Health to conduct studies and interventions that decrease the incidence of HIV. Tuberculosis is being combated by introducing a new drug for the first time in 45 years that helps fight drug-resistant tuberculosis. 94.4% of Thailand's citizens were vaccinated against COVID-19, attributing to the high percentage of those that were able to recover. Thailand's SDG goal of good health and well-being is on track to be accomplished by ending the malaria, HIV, and tuberculosis epidemics in the country by 2030.
So now we will talk about the prevalence of non-communicable diseases in Thailand. In class, one of the big things that we talked about was the shift from CDs to NCDs, and this has everything to do with economic development. The prevalence of non-communicable diseases has increased significantly in Thailand, as the country has moved from being a low-income country to being a middle-income country. Non-communicable diseases account for approximately 71% of deaths globally and for 74% of deaths in Thailand. The leading causes of death in Thailand include ischemic heart disease, stroke, followed by lower respiratory infections. So from this, we can see that the top 2 of 3 leading causes of death are non-communicable, and the top 8 out of 10 leading causes of death are also non-communicable. Global morbidity and mortality rates have increased as non-communicable diseases have increased. So when talking about NCDs, we have to talk about the risks because risks are lifestyle patterns. Some of the NCDs and risks included for Thailand include smoking, an inactive lifestyle, hypertension, and alcohol consumption. According to the World Health Organization, NCDs have had a significant impact on Thailand's universal healthcare budget. In 2009, for example, the economy lost a significant amount of money due to this. Mental health has also posed to be a challenge in Thailand. Due to all of the social determinants of health, many Thais struggle with mental health. In fact, it has been suggested that poor mental health accounts for 7.4% of dailies in Thailand. So when talking about non-communicable diseases, one of the things that we have to really reflect on and emphasize on are the Sustainable Development Goals. The third SDG, which is good health and well-being, incorporates many targets reflecting NCDs and prevention, specifically in sections 3.5, 3.6, 3.B, and 3.D. 3.5 talks about strengthening prevention and treatment of substance abuse. These are NCDs, and they are planning for prevention. In 3.6, they talk about halving the number of road and traffic accidents. In Thailand, we've learned that due to economic disparities, they've had a lot of road accidents, and they're not uncommon. They're actually still pretty common. So in 2009, they were the 3rd leading cause of death, and in 2019, they were the 10th leading cause of death. So since this SDG was created, it's had much improvement. 3.B supports research of vaccines and other preventable measures. We know that prevention is easier than treatment. And 3.D emphasizes strengthening risk reduction. So Thailand not only is a part of the SDGs, but they've also implemented NCD strategic plans. So this is a plan that focuses on addressing the increase and prevalence of NCDs in Thailand. So it targets decreasing the rising mortality rate in the under 30 population, decreasing risks in the working male population, and tackling obesity. It also strives to establish awareness among communities about the risks and prevalence of NCDs.
So now we're going to talk about some of the disasters and CHEs that have happened in Thailand. So in 2004, there was a devastating Indian Ocean tsunami caused by an earthquake that very much affected Thailand quite a bit. One of the main things being their fishing industry took a big hit. That's one of the major ways that families in Thailand provide for themselves, either through the sale of the fish or consumption of them. People were hesitant to buy fish just because of the flooding and the people that had passed away and were still not found yet. There was extreme flooding again in 2019 and 2021. In 2019, it affected over 150,000 households. And this water quality is being heavily impacted by irregular weather patterns that have overtaken the climate of Thailand, that being extreme droughts and then just lots of rain and flooding. In 2021, there was flooding in Bangkok after several hours of rain. Flooding reached about a meter in height. So their government has been promising to drill in pipes to kind of make the cities more easily drainable. And that's something that they've been saying for quite a few years now, and we haven't seen any of those reflected yet. So this is just a picture of where the tsunami took place. So as you can see, it basically that main area is right around Indonesia, but then Malaysia and Thailand are kind of the next ones on that next outer circle. So talking about water, sanitation, and hygiene, before the year 2000, many people in Thailand lived without access to hygiene necessities or clean drinking water. So if the water was left untreated, it poses the risk of infectious diseases, some of those being hepatitis A and E and typhoid fever. And all three of these are viral infections that spread really quickly in poor sanitation areas. And these are things that can be contracted through eating or drinking contaminated substances. So anything that comes into contact with this water, anything, just drinking it straightforward. So talking about that and the climate change, water resources are fading due to disappearing wetlands and the corroding of watersheds and overall population. Only about 2% of Thailand's wetlands still exist in the country today. And until there's better water resource management, there will be a continued cycle of water shortages in the future. In some areas, surface and groundwater are the main source of water for the people, despite being contaminated, and they're still being consumed. Sanitation and clean water access have a vast impact on quality of life. So I kind of have here like a little now what, now that we know what's going on, and I have a quote here. The nation continues to support an attempt to improve sustainable natural resource management and environmental protection for both are vital tools for the sustainable development of resources. So the legislation now has placed a high value on recognizing proper sanitation and defining that water access is a basic human right and that everyone should have access to it. So along with these laws and regulations, the US has dedicated resource to improving sanitation in countries around the world as part of their MDGs, and that includes Thailand here. So one of the other CHEs that I want to talk about that's a big deal and is actually going on currently right now is the government in Myanmar, which is known formally as Burma. It shares a border with Thailand. The military staged a coup over a year ago. And since then, they've killed more than 1,700 people, arrested more than 13,000, and have systemically tortured men, women, and children. There's infighting between the Muslim minority group and the government, just because in this main area, most of the believers here are, in fact, Buddhists. So there's a lot of repression going on towards this minority group. So a fact about international refugee laws is that they forbid the return of people to countries where their lives may be in danger. However, Thailand has been sending back thousands of people that are fleeing the situation in Myanmar. And this leaves a lot of their refugees having to bounce back and forth between both sides of the river. That kind of almost separates the two borders of the countries. So as fighting comes out, they'll go towards Thailand, and as it comes back in, they'll go back towards Myanmar. The argument of the Thai government is just that there is a population of these refugees that are crossing illegally, and according to the law, they're forced to send them back. Therefore, they're not refusing help, but just following the law. According to some aid groups, Thai authorities send refugees back as soon as there is a pause in fighting. But the UN High Commissioner for Refugees says that 17,000 have sought refuge in Thailand since takeover, but only 2,000 are living on the Thai side of the border. So this is a little bit about the situation. So on the left over here, we have the winner of the 2021 general election. The military stated that it was a rigged election. And so this woman right here, who's been kind of one of the prominent leaders in the country, is actually in jail right now, and she's 76 years old. And then on the right, I just wanted to give a little bit of a comparison just so you kind of geographically know where Myanmar or Burma is in regards to Thailand.